Welcome to Brainthropology. Let's talk about our amazing brain and the issues that get us stuck. We all have those moments where life gets overwhelming. It can be related to injury or illness, or an issue with your kids, or just because life is crazy and we need a little help and encouragement. Our team of therapists, expert guests, and clients are here to deep dive into the topics that matter most. We will share information with our listeners that encourages, educates, and empowers. We discuss and provide practical tools and strategies to change lives. We invite you into our community. But be prepared. This listener community is built through vulnerability and might at times be raw and emotional. We are here to provide free hope and support to those who need it most.
Hello, everyone. Welcome to the Brainthropology podcast. We have such an informative show planned for today. I am your host, Debbie Loftus, and we are very excited to have an experienced clinical psychologist on with us today, Judy Malinowski. Today's podcast is about trauma and its effect on the brain. We are so grateful to have someone in studio with us that is an expert on this subject to share her expertise with us. So being an occupational therapist that specializes in brain injury, I find that most of the time our clients have been through some sort of trauma, whether it be in their childhood or whether it be the actual accident. So I'm really excited to talk about this. But as always on the Brainthropology podcast, before we get started, we like to encourage people to start their day with gratitude. And the way we do this on our podcast is sharing a personal or professional positive. So Judy, can you share a personal or professional positive with us?
I think this past week, the most important thing that I've noticed is that we've actually seen some blue skies and some sunshine here in Michigan. So I've been very, very grateful for that. And I know that many of my clients have made comments on how it's uplifted their mood. Just such a simple thing, but such an important thing. So I'm really grateful for the sunshine, even though it's pretty frigid out there today.
For sure. I'd like to think I was part of that. So my positive is actually, I'd like to think I brought the sunshine back with me, but I had an amazing vacation last week with friends that filled my cup up, and it was full of sunshine and the ocean. So my week was filled with so many positives, and I checked something off my bucket list, which was seeing whales in their natural habitat. And the area that I was at, the Sea of Cortez, they actually breed in that area, and I was able to see the mom whales teach the babies whales how to breach and how to use their tails, and I had many moments of tears coming down my face, and it was really powerful, so I was very grateful. So before we get started, you may recognize Judy as she has done a few of our podcasts with us on anxiety and depression, but just in case you haven't seen those, Judy, can you give us a little background about yourself and maybe some clinical experiences that you have related to trauma?
Sure. As Deb said, I'm a clinical psychologist. I've been in practice for over 34 years, which is mind-boggling to me because it doesn't feel like that long. It feels like such a blip in my whole life, but I'm so grateful to be able to do what I do. And I came into learning about trauma early on in my career. I specialized in chemical dependency counseling out of grad school.
Okay.
And then as part of that, I realized that oftentimes there's trauma connected to addiction, whether it's trauma that's driving the addiction or because of the addiction or substance abuse, there are traumatic things that happen to us. So it became just a natural outcropping, so to speak, on understanding how trauma affects us, how most of us have experienced some traumatic event at some point in time in our life. Most of us do not get through our life without having some sort of experience with trauma or knowing somebody that has. And I think what I've seen that's happened over the few years or the many years is that we've really come to pinpoint there's more than one kind. It affects people differently. And we really need to make sure that we are addressing it when someone comes into our office. It's not something that we can say, oh, that might happen to somebody else. We really need to be able to pinpoint it.
Yeah, it's interesting that you say that because when I looked up some facts about trauma, According to the American Psychological Association, 1 in 2 people will experience a traumatic event in their lifetime. And I was actually really surprised by that. That's 50%. So it's much more common than I thought. And it's also important to realize that trauma does not discriminate. So it can impact people of every race, ethnicity, sex, age, sexual orientation, gender, identity, and background. And as far to define it, I think that'd be a good place to start. According to the Substance Abuse and Mental Health Service Administration, trauma is an event that you experience as harmful or life-threatening, but it has lasting adverse effects on your mental, physical, emotional, social, and spiritual well-being. So before podcasts, we always do some research, and I always like to know the information that I'm talking about. So when I was researching this, it sounds like the general consensus was that experiencing a traumatic event can harm a person's sense of safety, a sense of self, and the ability to regulate emotions and navigate relationships, which is so important and impact people's life if they have a traumatic event and don't deal with it. The effects can be long-lasting, but it's really important to know that healing is possible. So, Judy, how would you define trauma?
Well, I think it is what Samsa said. It's that adverse event that you can personally experience, but you can also witness. And I think that's one of the things that we've come to the realization of. It doesn't just have to happen to you. You could be a child witnessing someone in your family being, violently attacked or murdered, or a parent being, assaulted. So that's that secondary or that witness trauma that we also have to be able to address. And so it is those adverse effects that impact our sense of safety. This safety and certainty is our number one emotional need.
It's so important.
And when that's rocked, if we don't address how that impacts our life, we'll go through life repeating that experience, which is what's really the most important thing about trauma therapy, and we're going to talk about that, is that by addressing it, you have to understand that this could prevent you from re-experiencing it again in your life.
Yeah, for sure. So you had mentioned there's different types of trauma. So I know there's 3 main types: acute, chronic, and complex. Can you explain the different types to our listeners?
Sure. Acute is one episode. It's intense, it's life-altering, and it's impactful. But it's that one episode. Say a car accident could be an acute trauma. Being in a storm, being, assaulted. Any of those types of things could be one episode, but it's so intense and so acute. Chronic is something that happens over and over and over again. And this is the kind of trauma that when we look at children who come from sexual abuse and it's gone on for years, or someone who's been assaulted and it's gone over, it's not just one episode, it's happening.
It's repeated.
It's repeated. Domestic violence, huge piece of this pie. First responders can have chronic trauma of what they see and what they experience. In military, chronic trauma. So it tends to be much more long-lasting over a period of time and repetitive. And then the last one is, remind me what
complex.
Complex. That's when there's more than one experience. It could be I not only witness it, but I also experience it. Okay. It could be physical, it could be sexual, it could be emotional, it could be all different things that interrelate with each other.
So multiple.
Multiple different things that impact me. I could be injured, I could be, all those different things.
Okay. So this might be a silly question, but how do you know if you were traumatized? Sometimes, it's obvious, but when you said, if you're seeing something or observing something, I don't know that people would associate that as being traumatized. So how would you describe to somebody, how do you identify if you were traumatized?
That is an excellent question, Deb, because a lot of people don't. They may come into therapy, they may have some things that they're dealing with in life, but they don't connect the dots that it was trauma that caused it. And so part of it is listening to this podcast. Part of it is perhaps someone has a flashback because they've gone and we were talking about gone and had a massage or had some body work and then starts to have memory flashbacks. And then they decide, oh, this might be something that I need to address. It could be that a family member is talking to them about their own personal experience and it triggers off their memory of having that experience. One of the aspects as a therapist that is important is that we ask the question, do you have a memory? Do you have a history? Do you have a knowing of whether or not you've experienced trauma in your past? Some clients, they can't access it yet, but they're coming in before depression or anxiety or addiction or any of those different things, and we need to ask the question.
In a safe environment.
In a safe environment.
So I know trauma can affect many areas of your life, including your emotional, social, and physical well-being. Judy, can you tell us about the different emotional and social symptoms of trauma? So even to the extent that I know we've mentioned on other episodes, but during extreme stress, the body and mind become overwhelmed, engaging the nervous system's fight or flight or freeze response. And I would love for you to go over that real quick again.
Well, it's interesting about the fight, flight, or freeze. So we're talking about the brain, and the brain and the mind are so intricately, connected. But one of the main things is the hypothalamus pituitary adrenal cascade. That's really what's happening in fight or flight. So when I look at that part of the brain called the limbic system, which is the amygdala, which has to do with our drive states, the hypothalamus, which is our emotions, and the hippocampus, which has to do with our memories, what we'll notice is that when we have either an external stimuli or an internal trigger, whether it's a memory, whether it's, just a feeling.
Sure.
When we have trauma, when you look at that part of the brain, that amygdala, what's that all about? It's all about safety. What's the hippocampus? It's all about memory. Hypothalamus, it's all about emotion. When we deal with trauma, it's affecting that part of the brain in such a way that I can have a memory, which triggers up an emotion, which triggers up that drive, that safety, which then kicks off my pituitary and kicks off my adrenals. What do? I go into fight, flight, or freeze. Depending on what happened when you were experiencing the trauma. Some people fought, some people fled. Most of the time when we're talking about children, they freeze. So that's how it's all connected.
That's so interesting. So I guess common symptoms that you would see somebody coming to be treated for, maybe intrusive thoughts or avoiding things that were what are some of the symptoms that you see people come in that they're actually being treated for? They want to come in to be treated for.
Well, they'll come in for depression. They'll come in and depression that's not easily treated.
Right, because
right?
it's deep down.
It's deep down. It's depression as a result of. And so they don't do well on medication because it doesn't touch that part of them. They may come in with anxiety disorders, addictions, like I said earlier, any kind of substance abuse. What is that connected to?
So the triggers, when you say connected to.
Right.
Okay.
Interpersonal problems. Definitely someone who might come in and say, I just can't keep a relationship going. I don't trust people. I tend to choose people that are abusive to me. Why do I do that? Why do I keep repeating the same mistakes over and over again and end up, hurt or abandoned or betrayed? All of those types of things. And so when we look at the physical, maybe they are coming in with chronic pain. Mm-hmm. People will come into therapy because they are being told by their doctor, you need to go and find what the root cause of this is. In fact, I happen to have a client who was seeing a physical therapist for an issue with her leg. Well, what we found is that the root was in trauma.
Oh, my goodness.
And her physical therapist said, this is emotional. You need to go and address this with the therapist because we could keep, you can go to PT all day long.
For the rest of your life.
For the rest of your life, and it won't address this. So, when we talk about the body literally keeping score, the body does keep score. And so whether it's emotional, I'm coming in because of anxiety, depression, whatever, or it's physical, I'm coming in with chronic pain or sleep deprivation, or I'm all of the different things that come from that, or psychosocial. my interpersonal conflicts, my inability, or maybe I come in because I don't have any interpersonal connections because I've withdrawn from everybody.
Oh, that's interesting. So it really sounds like traumatic stress can show up in your physical health. So some of the physical symptoms, just a little recap. So you talked about chronic pain, sleep problems, chest pain, headaches, hives. I've heard, and I've actually had experience that with myself, which is really interesting. I never thought that was associated. And doing research, it really has proved, there are studies that have proven that emotional issues come out in physical manifestations. Have you seen that through your practice?
Yes. In fact, one of the psychologists or individuals that I tend to send people to in reading her books is Carolyn Myss, MYSS. She has connected this in such a beautiful way to really help people understand that your body is holding on, to think that we're separate from our mind and our body. We're a system. And
Absolutely.
Right? So I can experience something physically, which will affect me emotionally. I can experience something emotionally, which will affect me spiritually and physically.
So when I was looking up facts about trauma, I wanted to see how common it was, as I did in the intro a little bit. But it's important to know that not everyone who has experienced a traumatic event will have long-lasting effects, which I found interesting. So several sites that I researched, including the CDC, stated that around 20% of people who experience a traumatic event will develop post-traumatic stress disorder. And many others might still have sub-threshold symptoms, but not necessarily turn into PTSD. Can you talk about PTSD a little bit?
Sure. PTSD, post-traumatic stress disorder. And what happens with post-traumatic stress disorder is that it is a result of trauma that goes untreated. So most of us, after we've experienced a traumatic event, will have what's called an acute stress reaction. Now, if the individual decides, you know what, this was a significant enough event in my life that I need to go and address this with someone, and whether they talk to even friends, whether they talk to their doctor, their clergy, they go in to see a therapist, whoever they choose to disclose to, that helps them process through their emotions and process through the experience. If it goes untreated because someone says, well, I should just be able to get over it, or they have individuals in their life that tell them, just get over it.
I was just going to say that we hear
Right?
that a lot. My brother or my sister, said, just get over it. Why? I don't understand why you can't get over it.
Right. Because most of us have a difficult time being around somebody who's in pain, especially emotional pain, because we don't know how to handle it. We don't know how to, help that person process it. And so when someone experiences something, and if they don't work through it at an early stage, they run the risk of having post-traumatic stress, especially if it moves into chronic trauma, which the person continually has it over and over and over again. I mentioned first responders, which I have the honor to work with numerous first responders, and that's one of their major issues. They have chronic trauma, but because of the nature of their profession, oftentimes they don't seek help.
Oh, goodness. And it's there. Most police departments do offer help.
Right. And it's finally starting to be much more acceptable and much more available, like you were saying. But if you don't go and talk to somebody, because you might have this idea that if I talk about what's bothering me, it's going to make me feel weak. It's going to make me feel vulnerable. So I just have to carry this load by myself. That's when we start to see PTSD.
And so in your expertise, when you start to see these symptoms creeping up on you, that's a good time to seek help.
Either that, when you see them yourself, or if you have a loved one that says, I'm starting to see some things going on. You're withdrawing. You are having nightmares. You may not remember them, but you're waking me up. You have a hypervigilance or an increased startle reflex, or you're seeing that maybe you are doing things like drinking too much or doing other, psychoactive drugs to anesthetize yourself.
To mask the pain.
Mm-hmm.
Okay. So through my story, I have learned that trauma is less about the event and more about how you respond to it. And I think that's such a powerful statement. It sounds like some events are more likely to lead to trauma than others. What would you say the main causes of trauma that you see in your practice are? So medical trauma, sexual trauma, etc.
I see a lot of physical trauma, individuals that have experienced domestic violence or they've experienced injury in some way, whether it's a car accident or some sort of accident. I also see sexual abuse, which is interesting because oftentimes I see this in a person who's coming in and they're in their 40s or they're in their 50s and they've never addressed it, and we're going all the way back into their childhood. So it's one of those things of, it doesn't matter how long you have had it, you can always get help. And that's the most important thing. That's the most important message here.
So as I stated in the intro, being an occupational therapist that specializes in brain injury, I see that is very prominent, whether it be a childhood trauma or most likely the accident itself that caused the brain injury being the traumatic event. Are there any types of mental health conditions that you have seen associated with trauma? So we've already talked about PTSD. Are there any other diagnoses that you find associated with it?
Any of the addictions, oftentimes, and that's important to understand. That's whether or not, we're talking about the chicken and the egg. Did the trauma increase the likelihood of substance abuse, or did the substance abuse result in a traumatic event?
Right.
So we have that. There's other, if we're looking at borderline personality disorder, oftentimes, or borderline personality traits, that the person might have a history of trauma in some way, shape, or form, some sort of abuse, depression, anxiety, all of those different types of things.
And we've talked about, too, in the other podcasts that we've done with depression and anxiety. If anybody wants any more detail on that, feel free to look up those podcasts. We'll link them in the show notes. Is there anything else that you wanted to talk about before we end today's podcast about trauma, Judy?
I think it's important to understand, and I heard what they said, about 50% of us have experienced trauma. I think it's probably higher than that. I think most of us, on some way, shape, or form, have had a traumatic event occur. Just because we have a traumatic event does not mean that it has to devolve into trauma. And the most important thing is to get help. Talk to somebody about it. Understand that you yourself are not damaged just because you've experienced trauma. You are not the cause of the trauma initially. And it's not who you are. It's something that's happened to you.
That's so important. So to sum up, it sounds like with proper treatment and social support, especially through trauma therapy, that many people can overcome these negative effects, experience an improved quality of life, and move toward healing. If you do want to hear more on how to heal from trauma and the different treatments available, tune into our next episode, as Judy's going to share some of the best treatment options available. And thank you so much, Judy, for being with us today and sharing your expertise with us. To our listeners, we hope that you found this podcast helpful. If you think any of your friends or family would benefit from hearing, please share this episode. Feel free to check out other episodes at brainthropology.com. And as always, we encourage you to be courageous and move forward in your day with hope, joy, and purpose.
While we love what we do and are as passionate as they come, the information on this podcast and discussion is for educational purposes only and should not replace professional medical advice. Please consult your own healthcare provider if you are seeking medical advice, diagnoses, or treatment for you or anyone else. We do our very best to provide correct information, but please understand science and medicine is ever changing. We welcome feedback, comments, suggestions, or correction of errors. This disclaimer applies to any guest or contributors to the podcast or blog.